Mr. Shin, 57-year-old male history. Stage 3 laryngeal cancer, completed chemo/radiation 6 months ago. Chronic dysphagia, weight loss, 15 pounds in 2 months. COPD, former smoker, quit 1 year ago. Medications, sucralfate, morphine PRN, lorazepam PRN. Admission, I can't swallow even water. I feel like food gets stuck in my throat. Clinical findings, HR102, RR22, SpO2 92% RA. Weak cough, stridor on exertion. NG tube inserted to 55 centimeters, unable to aspirate gastric contents.
This is a PA chest X-ray of an adult. The patient is well-centered. There is adequate inspiratory achievement and penetration. The most striking abnormality is the inappropriate placement of the NG tube. The NG tube is projected over the right main bronchus, with its tip in the right lung. The NG tube must be resetted before use. The trachea is central and the cardiac and mediastinum contours are unremarkable. The lungs are clear, showing no area of consolidation, lumbar collapse or pulmonary masses nodules. The costal phrenic angle are sharp, with no evidence of pleural effusion, no free diaphragmatic gas. There are old healed fractures of the medial end of the left clavicle, the fourth, fifth, sixth, seventh ribs on the left, and the seventh rib on the right. No other skeletal or soft tissue abnormality are identified. So in summary, this chest X-ray shows a misplaced NG tube which needs to be resetted before use, and the multiple healed fractures.
What does the X-ray most urgently indicate? A. Aspiration pneumonia. B. Malpositioned NG tube. C. Pulmonary metastasis. D. Rib fracture complications. Answer B. Malpositioned NG tube. Coiled in bronchus risks aspiration/pneumonia. Nursing action for NG tube in bronchus should be 1. Stop feeds. 2. Remove tube. 3. Reinsert with HOB to 45 to 90 degrees. The nurse's immediate action should be A. Flush the NG tube with 30 milliliters air. B. Administer 4 metoclopramide. C. Stop all feeds/meds via NG tube. D. Encourage deep breathing. Answer C. Stop feeds. Prevents pulmonary aspiration of formula/meds. Before reinserting the NG tube, what is essential? A. Elevate the head of bed to 90 degrees. B. Auscultate for stridor/gurgling. C. Administer IV furosemide. D. Obtain a sputum sample. Answer B. Stridor suggests airway obstruction. indicates need for HB elevation or RT support. Why is this patient at high risk for NG misplacement? A. History of rib fractures. B. Altered upper airway anatomy. C. Opioid use. D. COPD-related hyperinflation. Answer. B. Laryngeal cancer alters anatomy, increasing misplacement risk. The X-ray shows healed rib fractures. What nursing priority does this signal? A. Assess for osteoporosis. B. Screen for domestic violence/falls. C. Request a bone scan. D. Administer calcium supplements. Answer. B. Healed fractures in cancer patients raise concern for falls/abuse. What medication is CONTRAND-CTD if NG feeds resume? A. Sucralfate slurry. B. Lorazepam via NG tube. C. Morphine elixir. D. Omeprazole. Answer. B. Lorazepam benzodiazepine depresses cough/gag reflex aspiration risk. In patients with dysphagia, any drug that blunts consciousness or reflexes is a red flag. Lorazepam is the most dangerous choice due to its rapid CNS effects. The provider orders a barium swallow. What cancer-related risk exists? A. Aspiration pneumonia. B. Contrast allergy. C. Renal failure. D. Hyperglycemia. Answer. A. Dysphagia plus barium leads to a high aspiration risk. Use water-soluble contrast instead. In laryngeal cancer patients, barium swallow isn't just a test, it's a high-stakes intervention requiring rigorous safety screening. Aspiration risk outweighs all other concerns. Which finding requires urgent intervention if seen on repeat X-ray? A. Healed rib fractures. B. NG tube in left lung. C. Kyphosis of the spine. D. Enlarged cardiac silhouette. Answer. B. NG tube in lung requires immediate removal to prevent pneumonitis. Which assessment is most critical post-NG reinsertion? A. Abdominal distension. B. pH testing of aspirate. C. Bowel sounds. D. Skin turgor. Answer. B. pH testing is gold standard for gastric placement to avoid X-ray delays. pH testing of aspirate, pH lower than 5 confirms gastric placement. What teaching is essential for discharge? A. Take lorazepam with meals. B. Flush NG tube with cola daily. C. Check tube placement before each use. D. Increase morphine if pain worsens. Answer. C. Home NG safety prevents fatal tube misplacement. Mnemonic. Tube safety for NG placement. Tip position confirmed by X-ray/pH. Use pH testing first. X-ray if pH 5. Benzodiazepines contraindicated elevate HB above 45 degrees during insertion stridor. Stop and call RT aspiration risk. Screen cough/gag reflex. Flush with 30 milliliters water before/after meds. Educate on daily placement checks tracheal placement. Immediate removal yield to radiology if uncertain.